We are really working toward making sure that every American gets health care. There are some 50 million and rising people in our country without any health care at all. Many of them end up going to the emergency rooms where that cost is spread to everybody else. The fact of the matter is that health care comprises 1/6 of our nation's economy. 1/6. Imagine every $6 that you have, $1 of it goes just for health care. That's a lot of money. You add it all up and we're talking about $1 trillion. We spend more for health care in our country than any other developed country in the world. And our outcomes in terms of the health of our population, the health of our people, is really, really mediocre. So what we want to do with healthcare reform is lower the costs, maintain quality, and in fact improve quality, preserve choice for all of us. I had my own amendment, it's the Hirono amendment, and that amendment is to exempt Hawaii's prepaid health care law from the federal law. I wanted to make sure that Hawaii would have an opportunity to make a determination and assessment of how our situation would be impacted by any kind of federal law. And this is in recognition of the fact that in Hawaii, hundreds and thousands of people, full-time employees here and their families, are covered under our prepaid health care law, making Hawaii one of the healthiest states, if not the healthiest, in the entire country. In Congress, I will do everything I can to keep that exception in there so that the state of Hawaii we can make our own decision as to whether or not we want to continue with the prepaid health care law, which is the only employer-mandated law in the entire country, or whether we want to come under a federal framework. So I want our state to have those choices. It doesn't exempt the state, by the way. It just exempts our law. So the rest of the provisions that applies to part-time employees and all of that that we're really pushing for under the federal law would still apply. We recognize that there is no competition in the private health insurance market, and that is why the public option is so important, because the public option will provide competition to the private insurance market. What we're doing is not to take away the current coverages that people have and that they are happy with. We're trying to provide choices, and that's what the public option is all about. And the insurance industry hates the public option because that is the one thing that is going to force them to compete. There's a lot of emphasis in this bill on prevention because, as you say, we spend so little in our country on prevention. And when you prevent something from getting to a critical stage, you're paying less for that kind of care. And so that's why we're paying primary care doctors. We would like to reimburse them at a higher level under this bill. And then also there are some other bills that will provide loan forgiveness for people who go to medical school and specialize and work in the primary care field. Also, we need to encourage more utilization of nurse practitioners and other providers of primary care services. This is a bill that is going to be paid for. It is not going to add to the national deficit. What we're trying to do is improve a system that is broken. Both Republicans and Democrats agree that we cannot sustain the health care system that we currently have. Lower costs, preserve choice, create a better outcome for all of us in this country. So we're working on that. I hope that we'll have a bill to vote on the House floor before the end of this session.